Good afternoon, Dr. Allen.
Good afternoon to you, sir.
To start off, would you tell me where you went to medical school?
I went to medical school at the Tufts College Medical School in Boston, Massachusetts.
Right. And when did you graduate?
And I graduated in 1940, in June 1940.
When did you start practicing?
And I did not start practicing actively until after I served in the service. I did not start practicing until 1946. In January of 1946, I started to practice.
What was your specialty?
My specialty was called industrial medicine, or now occupational medicine.
That's right. And what made you choose occupational medicine?
That's an interesting question. I chose that because I was at home one day when I received a call from a member of the Worcester District Medical Society, and he told me that there was an opening. There was a doctor in Southbridge, Massachusetts, who had a chance for an assistant. He was getting older, and he wanted an associate or an assistant. And so I called him up. His name was Dr. Theodore Story, and he offered me this chance to work for him, which I did. And 3 years later, he passed away, and instead of assistant, I became the medical director of the Great American Optical Company. Yeah, that's good.
Can you describe a typical day when you first started practicing?
As I first started practicing in this business as the doctor's assistant, the first thing we would have to do would be anybody who was being hired had to have a complete physical examination. And whether he was a man or a woman has to pass the physical examination before he or she could go on the job. And from then on, we would do routine physicals. When a person had reached a certain age and was still working, say 50 or 45, we had to give them another examination to make sure they were still healthy. And of course, whatever happened in the shop, if any accident, we were summoned for any accident that happened, and we would either treat them there in our office or send them to the hospital.
Okay, so what were your hours like when you practiced?
The hours, well, we worked from 9 to 12 and from 12 to 5, 5 days a week.
Okay.
Regular, strict business. We followed the business.
So did you make house calls?
No, we did. When I worked there, I did not make house call. In a brief period, when I got out of the service in 1945, I did make a few house calls from my home in Auburn, Massachusetts, but very, very few.
Okay. Did you ever use the telephone to talk with patients?
Did I ever what?
Use the telephone?
Oh yes, certainly. The common yes, we certainly did.
When did you go to the hospital? The hospital? When did you go to the hospital?
You mean to visit patients?
Yeah.
Yes. Well, if anyone was get to the hospital and was not too severely injured, I would treat them and then send them home. But if it was at all serious, such as a break or a severe injury or bleeding, I would turn them over to their, what's known as the family doctor, if they had a family doctor, or we would hire a specialist to take care of them, yes.
What were your rounds like at the hospital?
Well, no, we had no real regular hospital.
Okay.
We just would, if we had a patient who were injured at work, I would just see that we would see them as they began the treatment. But if it was at all important or all severe, we would turn them over to another physician.
Okay.
Yeah.
So the rest of the time you worked in your office?
So most of the time was right there in the office
Okay.
at the hours that I mentioned. Yes, right.
So who were your patients?
Who were the patients?
Yes.
Well, they were mostly people in their late teens, and some of them of any age, right up to about 60 years of age. Yes, about 60.
Okay.
Yeah.
And where did most of them live?
Most of them lived right within 10 miles. They lived within 10 miles of Southbridge. Yes.
So patients were able to choose their physician?
Did they choose their physician?
Yeah.
Yes. Oh, yeah. Most of them had their own family physician. Yes, and we had very good relations with the family physicians.
How many patients of yours were in the hospital at any one time?
Oh, in the hospital at any one time, there probably were probably one or two.
Okay. Moving on to your family life now. What do you think it was like for your family to have a physician in the house?
Well, for my own family, it was pretty easily because I am married. We have no children, and my wife was a registered nurse, and occasionally she worked for us at the American Optical Company. She would also see cases from time to time, but it was very easy, her being a registered nurse, you see. Right.
Right. So, did you get to see your family often?
Oh, yes, yes. My family, living in Shrewsbury, we would see them on any holiday period. Oh, yes, we saw them very frequently.
Did you have any vacations?
Oh, yes. The company provided us vacation. We usually got about 3 weeks off in late summer. In the late summer, we would get 3 weeks off.
Right.
That's very...
Personally, what made you decide to become a doctor?
What made me I became a doctor because when I was a student at the University of Massachusetts, before it became a university, when it was Massachusetts State,
Okay.
I had a very good professor of botany who was also a philosopher, and he said that rather than study plants and flowers, I should take up medicine. And it was because of meeting this wonderful professor that I became interested in things other than just plain plants and flowers, which I was majoring in. I was majoring in botany. Yeah, that's how I got that.
So what made you decide to keep being a doctor once you had already started?
What made me decide?
Yes.
Well, I would say possibly, not possibly, but because I enjoyed it. I enjoyed my work.
Good. Why did you choose to practice around Worcester?
Well, because of that call which I received from the, just because I realized that, well, from Shrewsbury, I had been living in Shrewsbury at the time of the call, but I moved to Auburn, to be a little closer to Southbridge. I moved to Auburn, Massachusetts, and commuted daily from Auburn to Southbridge. Right.
Do you have a favorite memory from when you practiced?
Do I have a memory of
A favorite memory from when you practiced?
Of my practice?
Yeah.
Allow me to think just a minute. Do I
Sure.
have a favorite memory?
moment from medical school or any time during your career?
Yes, I received one favorite memory of me that I remember very closely is that when I was in medical school, I delivered one baby boy, and the people were so proud of the baby boy, and I had done so, they thought I had done so well, although I hadn't done anything extra. They named the boy Roger. That's that was my favorite memory. That's right.
Nice.
Yes.
Do you have a least favorite memory?
Do I have
Least favorite memory?
least favorite memory? Yes, I do. One day, we had when I worked at the American Opera Company, we had an hour for lunch, and I was walking around in the yard one day, and it was a little bit after 1. It was like 1:10, and I was called into the office of one of the managers there, and he laid me out in lavender, as we say, and he said the expression, "Here we work till 12, here we work till 5. That is my favorite bad memory. Yeah. Here we work till 12, here we work till 5. Yeah.
What were the most typical illnesses that you dealt with in the 50s and 60s?
But the most illnesses?
Yes.
Well, in my work at the optical company, most of it was common cold. They would come in, and we were allowed to treat them. We didn't have those days. We did not have to refer them to their family doctor. The common cold, especially through the winter months.
Okay.
Yes.
Did that change at all throughout the years?
No, it didn't, because I left after 35 years. I left, and it was before the new system had really come into existence.
So you did not treat any other illnesses besides the common cold, is that correct?
Well, we would say a person had stomach trouble or bowel trouble. We had all kinds of medicine. We would give the common ordinary medicine. The common ordinary illness, yes, we would treat them, and of course we would treat the cuts and bleeding of that nature.
Right.
The people getting hurt at work.
So, which particular illness was the greatest challenge for you to treat when you were practicing?
The greatest challenge for me to treat. Well, I think one of the greatest challenge would be the people that were getting really very nervous, people that were on, say, nervous, on the verge of a nervous breakdown, nervous condition, people getting very nervous or excited. Yes, that would be the thing that bothered me the most. It was hard for me. Yes.
Do you think that changed when you stopped practicing? Like, what do you think was the greatest challenge as the years went on and you retired?
As I get on. No, I think that remained about. I still see it today. The mind. People who get nervous. We used to call it nervous breakdown in those days.
Right.
You've heard that expression.
I think that's still used today. What was one of the most important breakthroughs in disease treatment during your career?
Let me think just a moment. In my career. Well, the way they began to manage, and now still manage, the way they manage heart conditions, the way they manage the heart condition, the valve of the heart, they had just begun to deal with artificial, before artificial heart, they were even using hearts, animal hearts and so on, to see how things would work. And the beginning of heart, the great beginning in heart surgery was a big thing in my era, yes.
What was the worst epidemic that you can recall?
The worst epidemic?
Yes.
I can't think of. Well, we had, in my career, we had two bouts of Asian flu.
Oh, right.
In my day, I remember very well people staying out of work and losing work. The 2 attacks of Asian flu. Yes, that's right.
Can you describe attitudes towards smoking and cancer throughout your career?
Could you repeat that again, please?
Describe attitudes towards smoking and cancer.
Oh, smoking. Oh, yes. Attitude smoking was changing only the last part of my career. Yes, I remember it took a long time for people. It took a long time for people to stop smoking.
Okay.
I had stopped smoking myself 1944. 1942, I smoked my last cigarette. I had my last cigarette the day that Rome fell. Italians, I was in Rome, service, an Italian soldier gave me a cigarette. I did not like the taste of Italian tobacco, so I quit, and I have never smoked since. But it's been quite a thing. Members of my own immediate family, they have smoked, but
Okay.
it's a bad thing.
Yes. What is something that doctors take for granted now that you did not have at some point in your career, in terms of technology?
Well, they didn't have the knowledge of complete examination of the heart. They didn't examine the heart as thoroughly as they do today, yes. I noticed that.
And what technology is still being used today that you used when you practiced?
What technology would be? Well, I can't think of anything for the moment that's different.
Okay, we can move on then.
Yeah.
Can you describe one important invention that you've seen throughout the course of your career?
You mean in medicine?
Yeah.
Yeah, well, of course, the artificial heart. Yes, I think the artificial heart is the big thing. Right.
Okay. When did that start being used?
Like artificial heart. Well, that's only been in the to be really efficient, only within the last 8 years, I'd say, yeah.
Okay. Did you have access to new technology when you practiced?
Yes, I would say so. As these things came along, we had access to, yes.
Okay. Is there anything that you would like to see invented today in the medical field?
I can't think of any one thing.
Mhm.
So many things being worked on. I can't think of any one particular thing that I would like to see.
How about in any particular area of medicine?
Well, again, in the to improve the things about the heart.
Okay.
Improve the things that they're doing about the heart. Yeah.
What were some of the most important drugs that you used in your practice?
Most important drugs.
Yes.
Well, I would say the most important, of course, would be the anti-inflammatory drugs. They were, as we use it, to get rid of inflammations of the lungs and of that nature. Yeah, anti-inflammatory drugs. Yes. I forget the name.
And those are still used today?
Yeah, the ones that are still used today. Yeah.
Okay.
Mm-hmm.
Did you always have access to the drugs that you wanted to use?
Oh yes, it was very yes. We have always had very good access. Yes.
What breakthroughs in drugs have you seen and when did they occur?
But great
Breakthroughs in drugs.
use in drugs.
No, breakthrough.
Oh, the breakthrough. Oh, the breakthrough. Breakthrough.
Yes.
Well, that would be how the anti-hypertensive drugs, the drugs for hypertension, have improved through the years. That's what I think.
Okay.
Anti-hypertensive drugs for hypertension. Yeah.
How did the changes in drugs in the drug industry affect your practice?
Well, I don't think it did not affect my practice very much. I don't think.
Uh-huh.
I didn't notice anything. So I have noticed something of things lately. Drug. They're watching drugs. They're watching drug prescriptions more than they used to. Yes, we just had a letter from the government.
Okay.
We have to have a license, a drug license.
How did patients without money get health care when you practiced?
Well, mostly if they have the, I can't think of the name of that right away. Well, they had to go to the town to get help.
Mm-hmm.
Yeah, they had to go to the town of Southbridge to get help. Yeah.
Do you think that everyone who needed care got it?
Yes, I think in my day, I think they did. Yes, I think those that needed help got it. Yes.
That's good. Over the years, how do you think Worcester compares to other places in terms of providing care for the underserved?
Do I think? I think it has improved. If that's,
Okay.
yeah, I think it has improved.
What were some fears and concerns about socialized medicine in the 50s and 60s?
Oh, the socialized medicine as it was coming in. The people used to wonder what it was going to mean, socialized medicine. They began to wonder about it, but they didn't know what to do about it. Yeah, it was questionable. They would question it. They didn't know what it was all about. Yeah,
Okay.
I think.
Were physicians involved politically on this topic? Were physicians involved politically on this topic of socialized medicine?
Yeah. I don't know. No, I was not involved in it, but I don't know how others were.
Okay.
I do not know how others were.
And what were your feelings on Medicare and Medicaid when they came into being in the 60s?
Well, as they came in, when they first came in, uh, I was for it. I was not against it. I began to see, I thought they were good things. As they came in, I thought they were very good things.
And what do you think about the programs right now?
Well, I think what the programs are, I think sometimes it is hard to get proper care under because of certain things, or because of certain rules they have. For instance, the selecting of the positions, and then the delegation of work sometimes, where a nurse, for instance, under the program, if you're dealt with, this may come up later on your question, but nurse practitioners, for example. Nurse practitioners, we think should not be allowed to do as much as they do. We'll probably talk about that a little later too, nurse practitioners.
Do you think the government has become more or less involved in healthcare?
I would say they have become, from what I know, I would think they have become more involved, yes.
Yes. And how has that affected physicians?
I don't know. It has not, in fact, it has not affected me. I really don't know how it bothers the other physicians.
And how do you think patients were affected by the government?
Oh, I think, well, patients, by the new systems, I think it's sometimes under the regulations, patients cannot get treatment, sometimes not fast enough or properly enough. We can speak later about that, but I know there's some problems there. I know in my own family the nurse practitioner is allowed to do physical examinations and even prescribe drugs, which I think is bad.
Yes.
We may be asking about that a little bit later. Yeah.
What would you like to see happen with government in healthcare?
Well, I would like to see it more or less get back to some of the old system where the patient is allowed to select his own doctor without going through what they call the guide, or what they call the without the guidance of the particular doctor. You could select. I feel that we should be allowed to select our own doctors.
Right. So when did HMOs first start to impact your practice?
HMO. Well, the HMO has really never affected my particular practice or my industrial, because I've been really retired now for so many years.
So, what do you have any comments on their impact on your field of medicine, or were you not around for that?
Well, I think it's hard for people to understand sometimes the rules that they have, all these various, it's hard to understand the rules of the new system.
Yes.
Yeah.
Did you ever have any involvement with Central Mass Healthcare or Fallon Community Health Plan?
No. We have a very good plan. My wife and I, we have a very good plan through the Pfizer company. You know the Pfizer drug company?
No, I'm not familiar.
They're the ones that make various medicine today. If I see, the American Optical Company was bought out by Park Davis, and then by Warner Lambert, and then by this Pfizer company. So as long as the Pfizer company sends me my pension and I come under their plan, which is the Aetna insurance, we have the Aetna insurance. It's very good.
That's good.
We like that.
Do you have any opinions on the positive or negative aspects of HMOs?
HMO. Well, yes, I have heard sometimes sometimes people have to wait, as I understand it. People have to wait to get the proper treatment.
Yes.
They have to go through the analysis of their case. Yes, I have heard of that. They sometimes have to wait. HMO, there's a delay.
And that can't happen in your opinion?
No, that's right.
Okay. Well, back to medical school. How much did it cost for you to go to medical school?
Oh, a good question. In my second year of medical school, my grandfather in Shrewsbury
Yes.
gave me, I think, $4,000. And he said, well, I guess I was finishing my first year. So he gave me $3,000, and he said that will be enough to finish your medical school, because $1,000 a year is actually too much to get through it. But it was very well done. What a difference between $1,000 a year and today's medical student for 1 year. Yes, it was quite a difference.
That's good.
1,000. I don't know how many thousand it is for 1 year down there, but I know that was it.
And how do you think that compares to the cost of medical school today? Yes.
Medical school is, it must be 20 times that.
Yeah.
It must be 20 times that, yes, from what I hear.
Did the cost of school influence how you practiced medicine at first?
No, it did not. It did not affect it at all.
And how do you think medical school costs today influence the choice of young doctors?
Oh, I think that today they have to think, they have to, I think it's a problem. I think it's a much bigger problem than it was in my day. I think they want to get the best school they have for the money that they can get a hold of, yes.
Okay. How have doctors' salaries changed over the course of your practice?
Well, I think the doctors' salaries, since my day, have increased. The doctors' salaries have enlarged, certainly.
Where was most of your income from in the early part of your career?
Well, in the early part of my career, as in the later part, it came from industry. It came from the company for which I was working. It did come from the American Optical Company. That was the, and in the latter part of my career, in addition to salary, I received from each pilot that I examined. I told you I was with the FAA, and for every pilot, he paid personally. He would pay, say, $30 or so for a physical examination before flying. Yeah. That was in the latter part.
And how has malpractice insurance changed over the years?
Well, I think it was, I think it has changed so that more and more people are suing for malpractice. I think it has increased.
What were the typical fees for an office visit when you began practicing?
I really don't know the exact fee because I was never asked. But for each pilot, I would charge about $30. I would I would charge, yeah, I would charge about $30 for each man that was going to fly.
Okay.
That was pretty.
What out-of-pocket expenses did you have for your practice?
Well, I had very little out of pocket since I was working for a salary,
Okay.
and I was living at home.
So, how did you learn the business of medicine? The business of
The
medicine.
business of medicine.
Yes. How do you think you learned it?
How did you? Well, I learned it by I learned it by experience. I learned it by different experiences. But yeah, I learned it by daily living, I would say. That's how I enjoyed it. Oh, what did I learned that the business of medicine, what did I learn? Oh, not how did I learn it, but
Well, yeah, how did you learn that?
how did I learn it? I learned it by just day after day, I would say.
Yes, okay.
One day at a time, yep.
Now, in the Worcester community, what are some changes that you've seen in the demographics?
In Worcester.
Yes.
Well, I see that people, they travel more. They go from one place to another to get medical care or something. They don't mind traveling. They go from, they don't stay close to home. They move around quite a bit. That's what I think. They don't.
And how has the ethnic background of patients changed over the years?
Well, I tell you, through the years that I was acquainted around with Worcester, I don't know. I know that around Worcester. I know there have been more people coming from, say, south. From Puerto Rico. There are quite a few people coming from Puerto Rico around in Worcester area. Yeah, I noticed that.
How do you think women's health in Worcester changed over the course of your practice?
I really cannot answer. I really don't know about that. I would have to pass on that one.
Okay.
Yeah.
Can you comment on how there have been changes in how children are cared for?
Yes, because we have grandnephews in our family. I think that has improved. There have been changes. People are bringing their children for important. They have important injections to prevent diseases. It's changed through the years. Their injection to prevent diseases has increased, I think. Yeah.
How has Worcester been different from other places that you've practiced in? Have you practiced anywhere else besides Worcester?
No, so I haven't. I haven't practiced, and I can't tell the difference. I don't know the difference in that one.
when you started practicing, what were public perceptions of doctors?
Oh, the public, oh yes, they were very well respected when they used to come to the home with, as we said, come to the home with the little bags. I think that the doctors were more, they were more respected then than they were today, than they are today. I really think so. Yeah.
Okay. Would you like to show off your little bag before we move on?
Would I like to what?
Show off your little bag right there. That you use.
Oh yes, oh yes. Well, we would carry in the bag, we would carry all the equipment, the thing for the reflexes, and we would carry, of course, the thing, and we have the various flashlights, various flashlights, and then all kinds of Band-Aids.
I threw away the blood pressure
And,
thing, but I bought a new one.
you got, yeah, the blood pressure thing is not, he'd like to see it. This is
Oh,
being,
you don't really want it, well, I
That's all right.
that's all right, that kind of thing. And then, of course, the thing for measuring,
whatever.
Yes.
measuring the, yes, very good. Get a lot of questions here.
That's great.
Good, huh? Good.
Now,
Good thing he wasn't interviewing me and my ideas about medicine.
there you are. If you have any questions, I told him you're a nurse and you may want to,
No, he's talking to the doctor.
oh, yeah, I know it, but you have a good idea. Yeah,
All right. Moving on now.
yeah.
How do you feel that the role of the physician in Worcester has changed over the years?
Well, I think it has changed. I don't think they, how shall we say it? I don't think they honor him or respect him quite as much as they did. They have, because there were many, very many good doctors, but we begin to wonder sometimes about
Yeah.
everybody, yeah.
And how has the role of the physician in Worcester stayed the same over the years?
Well, he's become,
Because he's not too familiar with Worcester.
no, I'm not too familiar with how it acts.
Well, that's the area where you
You
practice.
mean generally
Yes.
practicing? Well, you'd have to speak to what's going on out here.
Yeah.
You
But-
know, it's
We were speaking about how different it was from the house call doctor, yeah.
well, the fact that everything now, we discussed it this morning, he wanted to explain, you know, that we're not of the generation that believe in the primary care physician.
That was the name, I lost that name. The primary care physician is what,
Concept is not something that we
yeah.
are comfortable with.
Yeah, I don't have a primary, and I'm under care now of various doctors, a very good doctor because of me and so on. But they all say to me, why don't you go to your primary doctor? We don't have a primary care doctor, and we don't think we need one, right? At least not right away. But that concept bothers us. Primary care doctor.
Okay. Are there Worcester area physicians that you admired when you started practicing?
Oh, sure.
I think most of them are dead. No, most of them.
No, when you were practicing, honey, remember like Lester Felton, you thought he was a good urologist?
Oh yeah. Well, yeah.
Talk about it.
And the question is, I missed the first part of the question. They're not alive now, but that wasn't the question. What was the question?
Well, were there Worcester physicians in the Worcester area that you admired when you started?
Oh, exactly. Oh, yes, there were many. There were many in the Worcester. Yes, they were. Yes.
Bernard Stone?
Yes.
Normally older physicians, I guess.
Yeah, they were older. They were older than I was. Yes, older. Oh, yes, older than I was. Yes, and they're very well respected.
How about now? How has that changed?
We know a few.
All right.
We know a few.
What do you think it was like for female physicians in Worcester in the 50s and 60s?
Well, I think, I was thinking of myself only about how you would get, I think it was a little hard for them in those days.
Yes.
I think it was. Because the thing was that a lady should be a nurse, but a man should be a doctor. I think that's what we want to say. In my day, I remember that. They'd say to
Yeah,
her,
they were nasty to nurses.
and the doctors would,
The female doctors were nasty to nurses.
oh, they were?
Yeah.
Oh, I didn't know that.
Well, no, of course not. You weren't a female.
That's right. Yeah. Okay.
There weren't many either, you know.
Really?
Comparatively speaking, in Worcester at that 40s and 50s. Dr. Jane Fitzpatrick, she was there. She was a pediatrician. She's retired now.
Mm-hmm.
She was okay.
And how do you think the experience for the female physician in Worcester has changed since then?
Oh, I think it has improved.
Oh, yeah.
I think it has improved. It has improved, yes.
All right. How did group practices or hospitals treat blacks or other minority physicians?
Hmm.
Well,
I,
that was not a problem 50 years ago.
I really don't know. I don't.
Because there, I think in Worcester, the city of Worcester, perhaps there was only one or two black doctors.
Yes, and they liked it, and they were well liked. I think.
Yeah.
Yeah, they were well liked.
Okay. What do you like best about practicing in the Worcester area?
Being near his relatives.
Yeah. What you say?
Being near your relatives.
No.
Near your relatives?
Well, no, but I mean, he comes from a family that landed in the United States in 1631.
Oh God.
So, you know, he's a real old New Englander. That's why he likes to be here.
Well, I like the area here. And you say, what do I like about it?
Yes.
Well, I like. Oh yeah, what do I like about it? I like the friends I have in the area. I like the friends. I have very good friends. Sure.
And what don't you like about practicing in Worcester? What do you not like about practicing in this area?
Well, I think the fact that, you know, no, he's had a lot of eye problems, and in order to get the best medicine, you had to go.
I was going to say traveling, traveling around, especially at night. See, I don't travel at night. I can't travel. That's
No,
good.
but he means during the year when you were in practice. You know, you still, for the best, you went to Boston.
Yes.
But I think somehow with UMass, although we're not thrilled with that place, it's improved. But in his day, you know, if you wanted the best, you either went.
Oh yeah, well, that's where I see what you. Yeah,
That was the hardest part.
the fact that you had the fact that you had to travel, yeah, to get it, yeah. All right.
Okay. And well, what advice do you have for younger doctors that are just starting out in medicine?
I would say be polite. I would say the best. One of the things to do is be kind. Try to be kind to. Don't laugh at the patient and so on. Like, we have a very good example. One of my problems was bleeding. I had a rectal hemorrhage, taken too much aspirin. I shouldn't have taken it. And we were describing the color of the hemorrhage, whether it was not just red, it was kind of green, and it was blue or something. And the doctor that was treating us and looking at me said, "Blood, blood," like that. And he was so mean, you know, sounded so mean. Be kind, be polite.
Okay.
That's what I would say.
Do you have any further experiences or stories that you would like to share from your career in medicine or even medical school?
Tell them about the time you made fun of the head of pathology.
What was that?
You broadcast over the thing. This is Dr.
Well, that's a so story. What I would say in answer the direct answer to your question, take one day at a time. That's what I would say. Take one day at a time, and don't laugh at people. And what she's talking about was in medical school, there was a professor that had an awful language. He was an accent. He was very smart, but he had such an accent. And one day he wasn't there, and the whole class assembled and waiting for him to come, and he didn't come at all. So I imitated him.
Uh-huh.
And what I didn't know was that it was broadcast to the dean downstairs in the office. And I was called into the office. Oh boy. Be kind to people and take one day at a time. That's what I would say.
And don't have your hand on the doorknob.
Yeah, that's what they say. She has a doctor that always has his hand in it.
I'm the world's worst patient. And when I go to a doctor, before I decide if I want him, I pay him, see if I like him. If I don't have rapport with him, I don't want him, right? And one of my questions is, when I'm ill, I don't want your hand on the doorknob and half your body out in the corridor, because I'm the consumer and I want your full attention. If you don't want to play that kind of a game with me, I'll go someplace else. And when they get a customer like me, they play the game.
Okay.
And I think that that's where the doctors of today are failing the customer, because they're in too much of a hurry.
Yes.
In, they're out.
Doctors of today are in too much of a hurry.
Yes.
Yes.
Yes, take one day at a time.
Because they don't seem to realize that a patient is so anxious, and it's a very important moment for them. And they have this critter with his hand on the doorknob usually, and a bunch of papers that he's hurriedly looked at. I don't know how he can read them that fast. And he's out the door. That doesn't give you a feeling of comfort that he's paying much attention to you.
Okay.
But that's what my husband did when he was there. You know, he paid attention to them. He meets old people now and they hug him. You know, he was so nice, and they give him a big hug. Because he listened to them, for heaven's sakes, even if it was garbage. I hope there's not a fox out there after
All
my
right,
cat.
Dr. Allen. So before we finish here, would you like to comment on your service in the military or how that affected your practice in medicine?
Yes, I believe it. Being in the military did affect my practice. I believe that you should do good for people and keep going, as I said, one day at a time, and that try and think that there's always tomorrow. We hope there's always tomorrow. That's what I would say.
And did you tell him how long you were overseas?
I was overseas
37 months?
37 months.
Living
and
in a
part of the
hostel most of the time?
And for a good many months, 3 months, I was on the Anzio beachhead. That was when they were getting ready to attack Rome.
Okay.
And there was a beachhead. You may have heard about it. We landed on the beachhead and couldn't move. And the enemy was fighting us. Finally, we broke away. But I enjoyed, I look back on it now, and there were some enjoyable moments, but I learned how to take one day at a time. That's one thing I learned.
Okay.
Yes.
Well, I guess that brings us to the end of our interview
All
today,
right.
Dr. Allen.
Well,
Thank you very much.
Thank you very much for listening to me.
Yes.
Is this what you're
It's
doing
been
for
a
the summer?
pleasure.
Yeah. Would you like, how about